crack then got down into the healthy skin.
Yeah.
Hey everybody, it's Dr. Freels
pull
here.
out the scalpel.
I got the scalpel right here.
Oh boy.
This gentleman is a diabetic with a ulcer that's been here. It's just been building up and cracking. And have you noticed any bleeding or anything like that?
Just recently, the last month.
Last month, and it's been here for a year.
Mm-hmm. Not bad like that. It was on the bottom, like in the crease there. And it like
Thank you.
moved over.
Yes, it's just continuing to crack because the skin is so dry and calloused.
Mm-hmm.
This occurs in this specific location because you were born with this bone here elevated.
Uh-huh.
This is a really common place for a diabetic to get a wound. Yeah, we're going to kind of get some of this hard skin off first. Let's have you too high. Let me pull you down just a little bit. We may need to find those nippers. Ashley. Maybe not. Hold on. Ooh, what is it going to reveal? So I can't believe this has been going for that long. The reason that's
Kept it soft in the lake for the last month. I know you didn't want to hear that.
No, not at all.
But I did when it was like a wound, more of a wound, more bloody or whatever. I put a latex glove over it, wrapped it, and went in the water.
My concern is they're getting more soft, or they're getting soft tissue nippers. We had a little bit of odor now, so that tells me that skin underneath is necrotic. It's possibly, there could be an infection. Here you go. See, this is what the concern is it's not really closed.
Uh-huh.
It's just the callus over top of it giving that false illusion that it is closed.
So it like kind of sealed it though?
What's that?
Getting worse? Did it seal it from getting worse? Or?
No, it trapped it.
Oh.
It trapped it and it became necrotic underneath, which is why I smelled the odor, because it's just dead skin. So now that I got the big bulk of it off, here, let's see what we can, right there a little bit. What's that?
So now we're going to slice you.
Yeah.
That's where it started, like right on the bottom. And
Here we go. Keep that right there just like that for me. Let me see what we're working with here. Okay, so all of this is just dead callus buildup. So, Ashley, we have a neuropathic pressure ulcer from hallux limitus. Did you grab those?
Yes.
Oh, cool. So, thank you. So that white tissue that we're seeing here is called fibrotic tissue. Here we go. This is what I wanted. Yes, now we're in business. Oh my God, they're just not wanting to come off, is it? This is quite a bit of buildup. Come on. Now let's see all of that. It's so dry, it's almost like hard as a rock. But anyway, so when you have that trapped in there, it just kills the tissue underneath.
mm-hmm.
So we want to open it up, clean it out, let infection or whatnot drain. I guarantee you everybody's gonna comment on that little dot right there. 100%.
What is it?
There's a little spot with your skin, healthy skin. I mean, it's literally the size of a pinhead. Mm-hmm. But we've had this YouTube channel for so long. They always make the same comments about how I hold the instruments, which is interesting because that's the way that we were taught. Mm-hmm. But, every country does it differently. So,
mm-hmm.
Here we go. See, now we're getting somewhere. We can see that crack then got down into the healthy skin, and so get all this cleaned up.
Why did that blood blister like travel?
Why did it? Because of pressure.
Uh-huh.
You were still walking. You didn't stop. So because it's been open so long, I want to make sure that there's no bone infection. I looked on the x-ray. I didn't see anything. Actually, I did notice that there's a midfoot arthritis and a spur on the bottom and the back of his heel. Nothing really related to this, with hallux limitus and elevated first.
Years ago, I used to have in arch supports that a podiatrist made.
Yep.
And I lost a ton of weight, so I
probably weren't comfortable anymore.
Yeah.
Yeah, the orthotics are based on weight,
Mm-hmm.
and so they probably weren't feeling too good.
Yeah.
Okay. Get cleaning, cleaning, cleaning. Here we go. It's feeling better already.
I can feel it.
You can feel it?
I just started to, yeah.
Yeah, because all this buildup
When you were going back and forth scraping.
isn't allowing you to. And plus you have neuropathy.
Mm-hmm.
We know that you would not
Maybe
be.
that helps it or something. I don't have to have a shot.
It helps it that you don't feel me doing this, but it also makes you, when you are doing it, walking, you don't feel that it's happening. So
Yeah, right.
So this fibrotic tissue kind of serves as a wall and a barrier for ulcers to heal. So that's why you see me roughing it up, because I want to draw circulation to the area. In fact, we're going to grab you some wound care products to use and go over that in detail. This appears to be so far about 3 millimeters deep at least, because I'm seeing, and it's this area. So all this was breaking down underneath of it. Probably gonna need some fresh 4x4s, 3x3s, whatever we have. But we're getting it all cleaned up. Looks better already. So what we're gonna do to start with today, I don't think you need to be soaking it. We definitely are putting you on an antibiotic because it's getting red here, and with that odor smell coming out, I don't want to risk it.
Okay.
So this is our depth, that center area. So what the goal is with the wound care products, it'll fill in from the deep part, and then it eventually closes up over top.
Okay.
Future now, we are really going to have a good conversation next time about what we want to do in terms of offloading this for the future. Because when you have an ulcer, you have a 50% chance of getting another ulcer in the same spot. When this happens, this is the number one reason people get, diabetics especially, get amputations. This spot. I know. Because there's hallux limitus is so common. But the goal is going to be, we're going to take the pressure off.
What could I have done to made this better? Because all it was a blood blister.
Probably come.
That joint.
I know. You know, come call me. Call me. I'd probably drain it. I'd watch it really close for like a week or two.
Yeah.
And then we'd heal it and get pressure off, and then you'd be good to go. Okay, I think we've done enough cleaning for today. What we're going to do is put some Betadine on. I need to do the measurements for Ashley. Got some good circulation coming. Do you have any allergies?
No.
There we go. That's right in your foot up. Like every time I look up and your foot's here, so I'm just like, okay, let's do this. Are you comfortable?
Yeah, right. Sorry.
No, you're fine. 5, 6, 9 by 8. Okay. So I think I have some Betadine in here somewhere.
So I'm probably using that
I'll take a fresh one.
egg scraper thing that my
Yes.
wife uses. That told me to use that. That was probably the wrong thing.
Wife's fault. I'm hearing this loud and clear. So I'll take some 4x4s. I think I used all of those. Yeah. I want to make sure this blade gets to its home. It's perfect. So then what we're going to do is... Oh, no worries. Let's see if we can't get this nice covered up. What we're going to do is put you in a 4-foot offloading shoe. What that means is we're going to take the pressure off of this entirely so it can heal very quickly.
Okay.
It's a clean shoe, and again, it's the 4-foot. This part is a rocker.
Okay. All right.
Okay, that's one. Let's go here. And then I'm going to have you come back in probably about a week and a half to make sure the infection's gone. Any nausea, vomiting, fever, chills, diarrhea, anything like that, I definitely want you to call us, run to the emergency room, because that could be a sign that the blood is getting into, or the infection is getting into the blood. Outside of that, your antibiotic will be at the pharmacy. We're going to grab you a wound care kit to take home to change it every day. Discontinue anything that you've been doing before you came in. Okay. You're still like, using peroxide or anything like that.
No, I only did that once when I.
Oh, that's fine.
Yeah.
Checking your circulation here. Relax that foot for me. There you go. There we go. Good pulse, because if you don't have good circulation coming down, then a vascular referral would be appropriate. Because you have to have blood to heal a wound. Alrighty. We're gonna get you everything else you need. We're gonna do a follow-up video for sure. I really think you're gonna have a good outcome. I don't anticipate any issues. The only caveat is if you are walking on this a lot, because it's a pressure ulcer. Every step you take, exactly, it's doing this on the ground, so it can't heal, no matter how little you're up on your feet. All right, guys. Well, I hope you learned something today. Comment below. I'll see you next time. Okay, guys. I know you're gonna ask, why was that nail thickened and really it was discolored, and he was asking if it was connected to his ulcer, but actually it's not. It looks like a subumbral hematoma that has dried, and it's not a melanoma. It doesn't have any characteristics consistent with that. It was very thick, and so I would imagine, because he has neuropathy, that's why we have the ulcer. The pressure from the shoe created a lot of bleeding under the nail, and he didn't feel it, and so as he's walked and gone on, that blood has dried. Now, if that happens to you and it's painful, you absolutely need to have that nail removed, especially if it's over 20% covered with a hematoma under the nail. So it is not connected. There's your answer.